Good afternoon. I am Pat Horton and I lead the Georgia Center for Nursing Excellence. I use my 40 plus years in the healthcare field and experience to address healthcare workforce challenges by partnering with others to create a future that works for clinicians, patients, employers, and the community. I'm involved in local and statewide and national work that strengthens the nursing profession and addresses the workforce challenges and advances the future of healthcare work.
My name is Brittany. I currently work with a hospice provider in the Atlanta area. We are the largest nonprofit provider in this area. It's Visiting Nurse Health System, and my division is Hospice Atlanta. I've been here for about 3 years, and that's about how long I've been a hospice nurse as well. Been a nurse for 5 years in other areas, including med surg and psych, and some pediatrics. So found hospice and I don't want to go anywhere else.
So yes, I am the Director of Human Resource Talent Acquisition, specifically at Grady Health System in the city of Atlanta. An amazing opportunity to help people seeking employment at the health system. Everything from our dietitians, our people who serve the food, all the way to the security guard. So we bring on everyone within the organization. I've been in healthcare for a little over 25 years, although I still look 21. Right. But I love what I do. Extremely blessed to be able to work with the community and shed light. Excited to be here today. I'm looking forward to the conversation.
Tell us about your career path and how did you end up in your current role?
So I started in healthcare at 14 years old as a candy striper, which is a hospital volunteer. I'm not sure how many of those they have these days. I knew after volunteering, I wanted to become a nurse and work in a hospital. And during college, I needed to work to earn money to pay for college, but I didn't have any clinical experience. And I knew I wanted to work in a hospital and get some experience. So I first worked in the laundry at a hospital. And the next summer, I still didn't have any clinical experience. So I worked in food services and helped put food on the patient's tray line and monitored what type of food was being placed out there. Finally, I ended up with some clinical experience during nursing school, and I was able to work as a certified nursing assistant. And then I became an RN. I share this with you so that you can see that not everybody has a straight path into a professional role without possibly entering some entry-level positions and moving along based on your education and your experience. In healthcare, you can start in a variety of roles and progress in your career and go as far as you'd like to go. After becoming a nurse and working at the bedside, I moved into a leadership role and continued my education and training to get where I am today. One of the things I like about healthcare is you are always learning and being challenged to grow and develop, and you can continue to make a valuable contribution to humanity.
Sure. So in nursing school, I always thought that I was going to be in pediatrics. And I still thought that for most of my time through nursing school. And I really thought I wanted to do oncology, so pediatric oncology. And then going through nursing school, I was able to really look into all the possibilities that are really out there. Then I also really liked mother baby and labor and delivery, as most people do when they go through nursing school. But actually, the reality of it was that I had a hard time getting into nursing school, just because of how competitive it is. And I just encourage, to never give up, continue looking and finding the school that fits you. Everything happens for a reason. So anyways, got into nursing school. And the way that my path was led was away from pediatrics and away from mother baby and labor and delivery. So I actually went into medical surgical, so adults and geriatrics. Learned a lot and actually found out that was the best fit for me because I was able to really broaden my knowledge and understanding of what it was to be a nurse and to care for somebody, in all of these disease processes at the same time. So while I was doing that, I also did some psych. So I always encourage, don't just do one path of nursing, especially when you start, because you don't know if that's where you will land and you don't know what best fits you. So I did psych, which kind of goes into every nursing role. And then I did pediatric psych. So that was a little more specialized. Found out that both of those weren't really for me. So I had a friend that I went to nursing school with, and she was a hospice nurse. And I just saw how fulfilled she was every single day. She loved her job, and she was able to be that kind of nurse where you hold the hand of somebody and take that special time, with them and care for them, all throughout, not just physically, but mentally as well. And spiritually, if you really want to go that route or if it's appropriate. So then I thought, maybe I'll try hospice. And once I did, everything started clicking. I then realized after, of course, starting in the hospice industry, that while I was a med surg nurse, I was the one that was taking care of all the comfort care patients. And I absolutely fell in love with that. And I didn't realize it then. But then once I became a hospice nurse, I thought, oh, wow, that's actually what I was doing back then and didn't even know it. So I've always been in touch with nonprofit organizations, just the missions align with mine. And that's how I fell in love with Visiting Nurse Health System, Hospice Atlanta. And that's where I am now. And being able to advance my career in this role has been one of the most amazing things that's ever happened.
So I am a first-generation immigrant. My family, we are from Honduras, Central America. And so when we came to the States, my mother, we lived in New York at the time, worked as what they call is a home health aide, very similar to here in Georgia, what they consider a certified nurse's aide. And I can remember growing up, my mother working 12-hour shifts. She would leave at 6 o'clock in the morning and not come home until 10 o'clock at night some nights. And she would come home with different stories about the patients that she was assigned to. And so as I aged and I started to pursue my own career opportunities, I fell into the home health industry. And similar to Brittany, someone saw something within me, and I very quickly progressed from a scheduling coordinator to an office manager to a director of operations, leading up to a senior director of operations. And so coming into healthcare, I knew I didn't want to be the patient-facing side of healthcare, similar to both of our panelists here. I know I didn't want that side. I wanted to be the influencer. I wanted to make the impact on the other side. And so I made a decision to go back to school to pursue human resources. I realized that in my day-to-day responsibilities, the days that I enjoyed the most were the days when I was making policies, when I was talking to people about the organization, when I was selling the role to someone, right? Because I believe that while I'm not patient-facing, I make a difference in that patient experience by bringing the right people to the organization. And so that's how I wind up in human resources. That was about 20 years into my career. And I will share how I joined Grady most recently is when I relocated to Atlanta about 4 years ago. In LinkedIn, if you're not familiar with LinkedIn, there is a way where you can notify recruiters that you are available to work and that you're interested. And lo and behold, the recruiter for Grady found me on LinkedIn and reached out to me. And at that time, I was working remotely. I had been working remotely for the past 7 years. And so when he spoke to me about this opportunity, I was a bit hesitant. I said, I don't know if I want to go back to hybrid. Do I want to travel into the city? But I will tell you, when I went in and I met with leadership at Grady, it was instantaneously that I knew that this was the place that I wanted to be. I had been seeking an organization that aligned with my own personal values, right? It's really important to me that the organization that I support, that I work for, is a big community giver, is committed to the quality patient care that our panelists just shared, but more importantly, is an organization that gives back to their employees and continues to help us to grow. And so those are the things that was important to me as I progressed in my career, and I created this big pivot for me. So that's my story and how I wind up at Grady in Human Resources.
What is it like working in healthcare? What is the culture like?
So overall in healthcare, it is a team sport, and it requires individuals with a variety of skills to help operate the organization so the patients can receive the best care. Some individuals come in contact with patients, and others do not come in contact with the patient, but all contribute, make a valuable contribution to the patient's care. Clinical members work closely at the bedside with patients, while there's other individuals working in finance, marketing, and other areas that do not touch patients, but also make a valuable contribution. In healthcare, you experience moments of joy because patients get better and go home, and other times you experience sadness because there are difficult diagnoses or death. Overall, a healthcare career is challenging, exciting, and rewarding. You can start in an entry-level position, as we've discussed, and progress as far as you'd like to go while you're enhancing your skills and increasing your education, and while continuing to increase your wages. The culture of healthcare, and culture is about people, about how people think, feel, and act. In healthcare, you work together as a team to achieve the highest standards of patient safety and quality. This requires respectful interactions with your colleagues, listening and valuing each other's opinion and thoughts, and helping each other out. There also needs to be a culture of respect and dignity for patients, because we are treating and caring for patients who come from different backgrounds, different ethnicities, different values, different beliefs, and care must be individualized in order to meet the highest level of care for that patient.
Absolutely. So a typical day. So right now I'm in the role of a director of clinical services. So I've been out in the field taking care of patients and families as that, being the primary role. So I moved into being a clinical manager and then now a director of clinical services. So being a director, so I oversee the patients still, and I still go out and see patients. But I'm really looking out for the staff, and I'm making sure that quality and compliance components are all being met. So a typical day, little brief snippet there. A typical day, it always varies because there's emergencies that arise that need, emergent help or assistance, a family in crisis, assisting the staff with that crisis, talking with patients and families, making sure that they have what they need. But it all always surrounds one theme. And that theme of the day is making sure that the end of life path for every single patient is what they want and what they envisioned it to be. So it always involves, working through scheduling, making sure that visits are all assigned. If a nurse calls out or a social worker calls out, making sure that their visits are reassigned appropriately, because in the end, the show goes on and patients need to be seen at their regular frequencies. So all in all, it starts with scheduling, it ends with scheduling, ordering supplies, medications, talking through issues that come up throughout the day, meeting with other folks here, making sure that all of our policies and procedures and all of our projects that we're always working on are underway the way that they're supposed to be.
So here's what I will say. Working in the healthcare industry is not for the faint of heart, right? Depending on the role, depending on your level of responsibility, it can be extremely stressful, right? Especially if you're patient facing, you literally are putting someone else's life in your hands, right? So it requires a great deal of responsibility, a great deal of commitment. This is not the type of job that you can walk into just for the pay. Full transparency, right? You have to really show up every single day because this is what you want to do, whether you're the nurse, whether you're the doctor, whether you're the security guard, whether you're the transporter who's moving the patients across the hospital system, or you're in HR. You have to show up every single day with your best of intentions to really make sure that you're showing up the best way and representing the organization. Grady Health System, our work environment, because we don't typically use the word culture, but our work environment, we focus on three things. We're focused on the patient experience, right? How we show up impacts that patient experience. We're focused on the work experience. How I treat my colleagues influences how I show up every single day. And the third thing is quality, right? Everything that we do has to stem from a place of quality, has to stem from a place of, am I making the best decision for those around me, whether it's the patient or my colleague? And so our environment is really driven by that. We're also an organization that says it's a safe place. If you make a mistake, we want you to report it. Why do we want you to report it? Because it's an opportunity for us to learn from it. Imagine that. An organization that says, you messed up, not a problem. Let's talk about how it happened so we can prevent it from happening again, or we can teach somebody else so that they don't make the same mistake, right? And so that's the environment that I walk into every single day at Grady. And that's why it's so amazing, the opportunity that I get to do. And when I talk to people about joining Grady, because some of the things that I share, they're like, are you kidding me? That sounds like so much fun. Absolutely. We work hard, we play hard, and everything that we do is with the intention to ensure that we're prepared and we're ready to give back to the community, whether it be for the patients or potential candidates in the future.
What traits and skills do you think are necessary to succeed in healthcare?
So I have a list of patient skills because I feel they're all important. It sounds like a long laundry list, but the first one I put on there was compassion. And truly, when you go into healthcare, you're caring for people, and you really have to want to be in that profession and care for patients. You need to be honest and truthful, and sometimes that's really hard, and transparent, because you may be delivering difficult information, you may be communicating with families and other clinicians as well. Empathy, so that you can understand how that individual is feeling, how families may be feeling. A serving attitude. It is a service. We are caring for others, caring for each other as part of a team, and caring for patients. Building relationships. I talk about this a lot because that is really what healthcare is all about, is building relationships, excuse me, whether it's with your team members or it is with patients. You have to be able to build a relationship. And again, that goes back to trust, earning that trust so that you can have a strong relationship. Being able to adapt to change. Healthcare is constantly changing. There are always things to learn and new things to experience. Critical thinking skills. Critical thinking skills, you're problem solving, you're putting patient information together, you're constantly having to think about what is happening with the patient and being able to communicate that information. And that goes along with having good communication skills as well. Also, we talked about problem solving, which is close to critical thinking skills as well. But cultural competencies, because as I mentioned, we are taking care of patients from different ethnicities, values, beliefs, and really being able to understand how you can effectively care for individuals that have other beliefs. And ethical, making the right choices for the right reason, whether that's very difficult. We need to make sure we're making good ethical decisions. Teamwork, as I've discussed in some of the other examples, teamwork is very important because the team has to come together to really be able to offer the best care, because each one of us has a service to offer. And then I would say resilience. And I say that because healthcare can be very demanding and challenging and rewarding, as we talked about, but having resilience, meaning you also have to invest in yourself and take care of yourself first. This is a wonderful profession, but because we're taking care of people, it can be very, like I said, challenging and emotionally demanding. And so you have to know what is good for you and what are the things that are going to help you sustain that resilience so that you can continue to contribute to others. And I would say there's a quote by Maya Angelou that I always like to remember, and that is, people will forget what you said, people will forget what you did, but they never forget how you made them feel.
That's a good question. The first three that pop into my mind, one is patience, patience and family. So different level of different patience, but our clients, they have to learn about what's going on in their own body as it's declining and how the disease process is going to look. And health literacy is an issue across the board, across the nation, probably across the globe. But we just have to meet them where they are. And sometimes that requires a lot of patience on our end because we want them to understand. We want them to have a peaceful passing at home rather than in a hospital. So, finding other resources or writing things down if you notice that they're not understanding. It does take a lot of patience because, these families are switching from, their loved one being completely independent, and now they require 24/7 care. So, one, they have to learn how to care for them in that condition. And two, they have their own emotions that they have to work through. So that one's big. Confidence, going into a home and exuding confidence is very important. This field, the home health field, home care field, hospice field, is very autonomous. So you are the only nurse in that area. There's of course overlap, but primarily it's one nurse that's assigned to a patient. And if you don't walk into that home exuding confidence in caring for that person, it's going to be really hard for that family to buy in to the education that you're providing and getting them to understand what is going to happen before it happens. So, exuding confidence is big. And the last personality trait I can think of that would be most pertinent would be you have to be eager and willing to learn. All disease processes do not present the same. It may be heart failure, right? So heart failure for me would look different than somebody, 30 years older than me. So knowing what the disease progression is going to look like and being eager to learn that not every person is the same and to be able to adjust to what's happening with that particular client because maybe they have other things going on that are contributing to that disease. That is their, for lack of better words, their terminal illness that they've been dinged with. So you have to be willing to learn and you have to be willing to adapt.
And so I think it's important to notate that Grady Health System is more than just a hospital, right? Grady is a building, right, that encompasses healthcare within that setting. We also have 10 different ambulatory clinics also referred to as neighborhood healthcare centers, right? We have 2 additional behavioral health locations that we partner with the city of Atlanta with. We have a long-term care facility, also referred to as a nursing home rehabilitation center. And so when you think about Grady Health System, please remember that it's not just that one building, not just that one hospital. And so with an organization of that size, there are so many different roles. And that's one of the reasons why conversations like this are so important, because oftentimes when someone doesn't know about healthcare and they hear the term healthcare, they immediately think doctor or nurse, right? And there are so many other components that fall within the healthcare industry. And I'm just going to list a few. Outside of the doctor and the nurse, probably the 2 most important roles, right, within the healthcare industry, you also have roles like unit clerk, right? Someone has to answer the phone, someone has to type up the messages, someone has to write the email, someone has to greet the guests when they're coming in. We have public safety. Someone has to keep the building safe. Someone has to secure the parking lot and make sure people are getting in and out of the respective locations safely. We have internal patient transporters. That's someone who can just take the patient from room A to room B, take the patient from room A up to get x-rays back down to the room. We have roles like social workers. We have behavioral health therapists. We have escorts. We have people who drive patients home, who just drive a van to get the patients back and forth. We have EMS. Those are the individuals who pick you up when you have an emergency. So many different roles across the healthcare industry. And obviously you have the non-clinical roles, such as what I'm in, and human resources. But in addition to that, we have a health equity department. Those are the individuals who are out there making sure that people are aware of how they can access healthcare, right? And how important it is that no matter what you look like, what ethnicity you come from, you deserve quality patient care. And so with all of that said, right, each one of those roles will require sometimes degrees, sometimes certifications, sometimes licensure. But I think outside of the academic component of those roles, some of the key traits and skills that we look for in candidates is someone who can demonstrate empathy, right? Because each one of those roles requires you to be able to see yourself in that person who you're working with, right? And it requires you to be able to sometimes give someone grace, i.e. have patience with the person, right? The traits that we look for in candidates, we're looking for people who can demonstrate a commitment to the role, right? One of the things that we see often when people come to our job fairs is, I just want any job. No, it has to be more than that. You need to know what your skills are and how you can take those skills that you're good at and transition them into a role, right? Those are what we refer to as transferable skills, right? So customer service experience, someone who's accustomed to working with the public, who has a lot of patience, who knows how to not allow things to escalate. Those are great skills and traits that we're looking for in candidates. Some of the other skills that we look for that are key within the healthcare industry: ability to follow directions, right? If we say we need the wall to be painted blue, we don't need someone who's going to say, well, I don't like blue, so I think I'm going to do it green because that's what I want, right? We need people who can follow directions, because following directions ensures the safety of the patient, ensures the safety of the facility, and sometimes even ensures your own safety, right? We also need people who are creative, right? Neither do we want people who are just going to join within the healthcare industry, who are not going to be innovative, who are not going to come to the table to discussions and make suggestions on how we can do things better. That is at the core of healthcare, and how we've been able to do so much over the years is through innovation. It's through people coming to the table to say, well, I know this is how you've always done it, but what about if we do it this way? Because that can make it better, right? I think another key component to the skills that we look for in candidates are those individuals who are really passionate about giving back, right? I said it earlier in one of the other questions. Working in healthcare is not the kind of work that you can do just for a paycheck. Because to Brittany's point, some days are going to be hard, right? Some days are going to be very challenging. And at the core, you have to be able to remind yourself of why you went into healthcare to begin with. Why did you choose this career path, this role, this job? Because that is what will keep you going day in and day out when the days get hard, right? Regardless of what career you choose, there's always going to be a need for you to recenter yourself and to be able to say, you know what, I know today was bad, but you know what, I love what I do, so I'm going to come back tomorrow and try again. That is what you need to be able to remind yourself of and demonstrate, right? Because the work that we do is not easy. When you work in the city of Atlanta, we have the demographic of patients that we service are sometimes challenging, right? And there's no way to prepare someone to come into work to get cursed at. There's no way to prepare someone to come into work to get the door slammed in their face. You have to be resilient, right? Those are the type of skills and traits that we look for in candidates. And many of those things that I just shared with you are not easy to demonstrate. They don't show up so easily in your resume. But that is why you need to be able to speak to it, right? When you're talking with someone, whether it's in your 30-second elevator pitch, or when you've finally gotten that opportunity to do a screening or an interview. You need to be able to demonstrate all of your existing skills, any of your pertinent training, and how you'd be able to transition that into any one of those roles that I listed with that fall under the healthcare umbrella. So I hope I gave some good tips to some of the students here today.
How do you see healthcare changing over the next few years?
So this is an interesting question because there is lots of change going on now, and I think it's going to become even more rapid change, which means that we will going to have to learn how to adapt and continue to learn in order to move forward in the future. But I see healthcare being more integrated, very much a team sport, technology driven, and very patient centric, where the patient will have more opportunity to say and be engaged in their plan of care, and it will be more individualized and tailored to meet their needs. Patients will have access to telehealth and virtual care, making it much more accessible and also more convenient for the patient. AI and data analytics will play a huge role. It's already beginning to be used in healthcare for gathering data and helping us make better decisions. Treatments and planning, personalized medicine, we can use that data to help individualize that care. We'll be also using more wearable technology, which will engage the patient more and be able to monitor them from remote areas and empower them to manage their care. Mental health, I think, will be more recognized and will be more integrated into care as it should be. We will see more advances in potential cures and stronger focus on health equity initiatives, addressing the health disparities that we see. There will also be legislative changes in how care is delivered and financed. Healthcare is an exciting field. There's lots of opportunity and challenges, and we will continue to see medical advances and improvements that will improve the quality and the longevity of life.
AI, artificial intelligence, machine learning, right? More reliance on those things that kind of help the task be more efficient. But one of the things I also anticipate is, for years we've been talking about the nursing shortage, right? Or how there's not enough people going back to school to become nurses. And so what I've noticed within the industry recently is there are more organizations that are creating upskilling opportunities for their employees. what's happening is organizations are investing money in these upskilling opportunities for their employees by saying, okay, if you join us today and you decide to be an internal patient transporter, we'll pay for you to go back to school, or we'll contribute to your tuition for you to go back to school to complete X, Y, and Z certification, right? Almost creating our own internal talent pools. So I see that happening more and more frequently. And I think as to Brittany's point, as life on the outside becomes more expensive, right? Less and less people are taking the initiative to pursue higher education. And so organizations are realizing that, wow, if we really want people with this level of experience or this caliber of academic background, we need to create the environment where they can do that. And so that's where upskilling comes into place. And so I think that's awesome, right? Because then you have individuals who perhaps have always wanted a more in-depth career in healthcare, but didn't have the means to do that. Now the organizations are creating those opportunities for them. So that's the first thing. I think that another way how we're going to see changes is just in the way in which patients are being serviced. Right. So today you can call the clinic, you can call the hospital, and you can now do appointments online. Right. So fortunately or unfortunately, the ability to have many of these tasks done automated is going to eliminate some of the roles that we currently have, right? And so how do we prepare those individuals today that do the scheduling when we know 5 years from now, that scheduling is going to be done on someone's phone, right? And how do we prepare them for the next step in their career? So it's really about, as we embrace the artificial intelligence, as we embrace the machine learning that's making these tasks more efficient, how do we bring those employees to the next level and make sure that they're prepared for their next roles, their next opportunities? And that requires training.
What advice do you have for those who are just starting out in healthcare?
So as I've said, I've been in healthcare for a long time, and I've thought about that. And there's some things that I will give as advice from learning along the way. And some things that maybe I wish I had had the opportunity to recognize those things. The first is to find a mentor. I really think finding a mentor when you're beginning your career can be very helpful and give you valuable feedback to think about. There may have been things that you said or did, and you want to improve in those areas. And usually a mentor can ask the right questions to help you dig down and figure out how would you like to improve or change the way you addressed whatever that situation is. Ask questions. Never be afraid to ask questions. None of us will know it all. And yes, there may be times when people make you feel silly, but don't let that make you step back and not ask questions. Healthcare, as I said, is changing and adapting, and there will always be questions, and we're in the business of taking care of people, and it's always better to ask those questions and get an answer versus thinking you might know and step forward. Learn time management and prioritization skills. In healthcare, there's always more to be done than we can get done, whether it's in a shift or if you're working in a clinic or wherever it might be. So you need to really be able to think about, how am I going to manage my time? What needs to be done? And then be able to prioritize those tasks or those processes that need to be done. Respect and trust are earned and can be very easily removed. Meaning you earn people's trust and it takes time, but if you become dishonest or you don't live up to what the expectations were that were set, you may lose that trust, and it is very difficult to gain it back, and it takes a long time. Learn from your mistakes. Hopefully you don't make any major mistakes because we are taking care of people. but we all make mistakes, and hopefully you'll be encouraged to learn and review and think about those mistakes. And that's where a mentor can also come in to discuss those mistakes and how might you have done that differently. And lifelong learning. That is a challenge in healthcare because we are always changing and adapting. And that's, to me, what makes it interesting. And if I should say the word fun, because you're always learning new things, you're learning from each other, reading, going to conferences. I encourage you to do those things. Sometimes people get so busy, they miss out on that. But I would say anytime you have an opportunity to have a learning experience, take advantage of that and learn, because it will help you grow, expand your mind and your experience and your skill set.
This is my favorite question. Because one thing always pops straight into my mind is never settle and always strive for more. You know, going into a role and understanding that you're new to that role, be a sponge and try to really grow and understand what it means to master that role. And then always look for something next. So there's always somewhere to go next. So, and I'll just speak on in the hospice industry. So you come in as an RN case manager, you could then become a senior case manager. So then you're overseeing all the newer staff that come in and help train them to be a preceptor. Then the next step up would be becoming a manager, and manage a small group, and then moving up to a director of clinical services, and then always striving for more. You can become an executive director and run your whole program, or be a branch administrator. You know, never settle and always learn, find opportunities to learn, go to seminars, do online training, do CEUs, go to networking events, go to conferences. There's always something more for you. Only if you want it, though.
Awesome. So one of the things I like to tell young adults is do your research, right? I think a great tool that not enough people take advantage of is the platform called LinkedIn, right? So whatever the role is that you are envisioning for yourself, right? You go to LinkedIn, you type in that title, you find someone who's in that role, and you ask, well, what we call exploratory call, a quick chat, a coffee and chat, whatever you want to call it. But you reach out to the individual and you say, I would love to learn more about what you do because I'm interested in the career in blank, right? And I would say almost 90% of the people who you message will respond to you and will make time, right? Because we are all willing and wanting to tell our story. Let's just be honest, right? And so having that conversation with someone who's doing the work that you envision for yourself is a great opportunity for you to really get a clear understanding of what the day in the life is. What does that feel like day to day? What are some of the traits and skills that you need to be developing and or working on to make you the best candidate for that role? But it also could be what you need to solidify your decision. And at the end of that conversation, right, similar to Brittany after her one day with the doctor, you may say, you know what, this is not what I thought it was going to be. Let me try the next one. And you continue to have those conversations until you hear, you see, you feel that this is the right role for you. I can't emphasize enough how important it is to identify what your strengths are and look for roles that play on those strengths. If you have amazing customer service and people have always told you that you have a welcoming spirit, that you do great work, if you're an usher at your church, if you always serve in your school and you used to do, the Pledge of Allegiance, or you would be the one who welcomed new students. Maybe what your role is public safety. Maybe what your role is the unit clerk. Maybe what your role is the front desk receptionist. Maybe what your role is human resources. You can take those skills and transfer them into a role. The second part I will do in respect of time, I think it's really important that you know what brings you joy. I tell my kids, I have young adults as well, and I tell my kids all the time, if you do what you love, the money will follow. Okay? If you find what you're passionate about, if you find what brings you joy, that what makes you excited every single day to get up, you will find a way to make money from that. That is the most important thing I can tell you when you're thinking about stepping into the healthcare industry, because there's just so many options of how you can apply your skills. But number one task is to find what gets you excited, what's going to make you want to get up for the next 20, 30, 40 years of your life.